July 4th. Provision after provision in that bill could change people's daily lives, including access to health care or food programs.
NBC7's political reporter Joey Safchik tells us what those changes could mean here in San Diego.
I'm going to focus on the impacts of the Medicaid cuts for a minute. Democrats have been sounding the alarm on that front for weeks. They say the cost of those cuts is people's health. But Republicans say the cuts will return the program to its original purpose by pushing people who can work off the rolls. A grueling weekend in Washington, D.C. as the trickle-down effects of the so-called Big Beautiful Bill on San Diego become clearer.
It's going to happen fairly quickly, and I'm not sure most local governments are prepared for it.
The county's budget relies heavily on federal dollars. Those dollars help people facing food insecurity, which has reached pandemic levels, and supports the 1 million people in the county enrolled in Medi-Cal.
Definitely people are going to lose coverage.
TrueCare is a healthcare center in the county serving people with high barriers to access. They're already preparing to potentially par down services.
We see patients regardless of their ability to pay, their immigration status, any of those issues. So we're still going to see the patients. The issue that we're going to have is that we're not going to be reimbursed for that.
Border security is another provision in the bill with particular bearing in San Diego. There's increased funding for ICE and the border wall.
The Trump administration is touting how few people are crossing the border at the moment. So if the border is secure, if it is indeed safe, then why the need for additional funding?
So what options do local politicians have to fill the gaps when it comes to health care coverage? Well, that's where this controversial conversation about digging into the county reserves comes into play. But even that, we're told, is a Band-Aid solution. Joey Safchik, NBC.